All right, we're going to go ahead and get started today. Welcome everyone to another segment of Numbers with Nick. My name is Nick Zupan. I am the Rock County Public Health Department epidemiologist. So today we're going to be talking a little bit about some of the changes in the COVID pandemic that we've been seeing. We'll talk a little bit about the Omicron variant that's just come to light just recently. And as always, we'll try to answer any questions if you have any questions. While you're watching the video today, you can put those in the comment section and we'll try to answer those at the end of the video. If you're watching the recording of the video, we will always try to answer questions on the next video, or we can follow up directly with you via Facebook or social media otherwise. So without further ado, let's jump into the content for today. So the screen here that you're seeing is our Rock County Public Health Department website. So the website URL is co.rock.wi.us/public health. And you can get lots of different information on our public health website, but one of the pieces that I'm going to share today is related to our COVID-19 reporting. So you can click on the image at the front and center of the landing page there for the Public Health Department page. And if you've seen the videos before, this is very familiar for you, but we're just going to go down and check out some of the data that we have related to COVID-19. So one of the reports that we do update on every 2 weeks is our Rock County Reopening Dashboard. And this is a report that has a number of metrics that was developed early on in the pandemic to give us a sense of how we're doing. I think the CDC has provided some thresholds for case activity and transmission and things like that we also are using now, but want to let you know that we are still updating this report every other week. So our last update happened yesterday, and just going to walk through some of the metrics that we do have on this report. We won't go into great detail today to talk about this. We've talked about this report on past videos and past live streams. So if you want to check out some of our past recordings, you're more than welcome to do that to get a more detailed look at the data. But really, real briefly, what we capture is percent positivity, which is a measure of how many people are being tested in the community and how many of those tests are coming back positive. We are seeing a pretty substantial increase in our case activity right now. So over this last 2-week period, we had over 1,000 positive results. And out of less than just under 10,000 total tests being administered in that 2-week period, that gives us a positivity rate of about 10.2%. I'm going to skip through a little bit of this information because it's a little bit duplicative. And again, if you are interested in seeing a more in-depth view of this data, you're more than welcome to check out the recording of a previous stream of the Numbers with Nick segment. The other piece of data that I wanted to highlight for today was just the hospital resource status. So we are getting reports from our healthcare partners that 100% of our hospitals in Rock County are at or near their capacity for their ICU or general medical surgical bed availability. So what this means is that there are very few beds available in Rock County hospitals for patients who are needing to be hospitalized, whether it's for COVID or for other types of illnesses or health conditions. And we're seeing a pretty low kind of bed availability for the past several weeks. So this isn't necessarily new, but when we do see increases in COVID activity, we tend to get a little bit concerned because that also means that there's the possibility for increased COVID cases that require hospitalization. And so what you can see in the graph here at the bottom of the page, this is the number of patients who are receiving care in the hospitals on a daily basis. And the most recent data here is that there were 36 patients earlier in the week getting care for COVID-19. As of yesterday, there were as many as 40 patients in the hospital getting care for COVID-19. So these increases, along with everything else that the hospitals are seeing at this time of year, is putting a little bit of strain on our bed availability and making it a little bit more concerning in terms of getting people the treatment and the care that they need. It's also leading to increased wait times in the emergency departments and waiting rooms and things like that. So we are seeing some of the resultant case activity trends kind of causing some issues in terms of our healthcare resources right now. So I wanted to make that clear on the video today. And, if you test positive for COVID-19 and you have some concerns about your symptoms, the best course of action is to talk to your primary care provider first before you go to the emergency room. If you're having severe symptoms, the emergency room is always an option. But what the emergency departments are reporting is that they're seeing some instances of people showing up with more mild symptoms. So it's important to talk to your healthcare provider first, your primary care physician, and work with them to make the decision whether or not you should seek treatment at the urgent care or at the emergency department. The other piece of information that I'm going to cover for today is related to contact tracing. So contact tracing is what the public health department does for all reportable communicable diseases. So not just COVID-19, but what we do when we get a report of a communicable disease like an STI, and in this case, COVID-19, we make contact with the individual who has tested positive for COVID-19 as quickly as possible and provide them with information about how they can protect themselves and how they can protect their families and their loved ones from spreading the disease to others in their household and in their community. So one of the things that we measure is contact tracing. And this isn't necessarily people who have tested positive, but it's people who have been in close contact with a confirmed case, because we know those individuals are at higher risk for contracting the illness. It's important for us to measure how quickly we're reaching the people who have been in close contact with a confirmed case to make sure that people are quarantining effectively and reducing their risk of contracting the virus and also spreading it to others if they do develop symptoms. So one of the problems right now that we're facing is that we are seeing so many confirmed cases on a daily basis that we are not able to capture all of the close contacts that those confirmed cases have been in contact with while they were symptomatic. When we have over 1,000 cases in a 2-week period, it makes it very difficult for our public health nursing staff to identify all of the people that may have been in close contact with those 1,000 cases. So I have a note here at the top of the page, but essentially we are in what's called the crisis standards of contact tracing. We are asking our confirmed cases to contact their own close contacts to make sure that they're aware that the individual has tested positive for COVID-19. And we do provide information for those positive cases about what they should be communicating to their close contacts. But in a situation like this, we are probably going to see individuals either not receiving contact from the health department or having some delayed contact from the health department, just based on the sheer volume of confirmed cases that are coming through our system right now. So I did want to make that clear in terms of how we're measuring this. And one of the challenges that we face when we do see increased case activity is based on, again, the sheer volume of cases and close contacts that our staff are not able to effectively follow up on each one of those individuals in a timely manner. So wanted to make people aware of that when you're looking at this data. We have been in crisis standards of contact tracing in the past. Notably last year, around the same time in November, December, January, we had elevated number of COVID cases and implemented kind of a very similar system in terms of having people who tested positive contact their own close contacts and provide them with the information they need to protect themselves. So the other data on here, I'm not going to go into. I'm actually going to switch gears a little bit and talk about the Omicron variant. So you may have seen the headlines in the news that the Omicron variant is the most recent variant of concern. Health researchers, epidemiologists, health officials across the world are paying close attention to what's going on with the Omicron variant because of the initial reports of how rapidly it is spreading in South Africa and the places that they're seeing community spread of this variant. So right now in Wisconsin, we have not had a report of the Omicron variant being identified among any of the confirmed cases. There have been a couple instances of the Omicron variant being identified in the US, and based on the preliminary evidence, coming from South Africa and the spread of the virus there, it is possible that we could see community spread of the Omicron variant. The concern with these variants of concern is that when we do have a new variant that is showing that it may be more contagious than a previous variant, it has the ability to kind of outcompete the previous variant, which right now is the Delta variant. And it leads to some possible issues in terms of immunity and things like that. So one of the challenges with the new variant is that it's uncertain how protective the vaccine is going to be against this new variant. And it's also uncertain how protective natural immunity will be against this new variant. So we've seen with Delta that there was an elevated possibility of people contracting the Delta variant, even if they were vaccinated, compared to previous strains of the virus. And also people with natural immunity were at higher risk for contracting the Delta variant. Even if you had COVID in the past, it was still possible to be reinfected with the Delta variant. So all of these these considerations and these potential concerns have not been proven definitively, and we're still awaiting more information on this variant of concern to really figure out the extent or the risks and things like that. And time will tell. We are paying close attention to the development of the information on the Omicron variant. And you can see, I've just put an article from CNBC, but this map just shows the different countries that are affected by the Omicron variant. So you can see it's been identified kind of all over the world, but right now we're seeing the cases that have been identified among people who have traveled, especially in the US and places in Europe and things like that. Like I said, it is possible that we could see community transmission of the Omicron variant if it is indeed as infectious as it has been shown in preliminary data from South Africa. And, if you're concerned about the Omicron variant, one of the best ways to protect yourself is to get vaccinated, and get vaccinated as soon as possible. And if you've already been vaccinated and you've completed your vaccine series, and it's been 6 months since you got the Pfizer or Moderna, or at least 2 months since you got the Johnson & Johnson vaccine, you are now, if you're 18 or older, you're eligible for a booster dose. So anyone can get a booster dose who is 18 and older and fits that kind of criteria based on when they were vaccinated previously. So again, the best way to protect yourself is to get vaccinated. And just want to also emphasize that the Delta variant is still the predominant strain in Wisconsin and in Rock County. So switching gears a little bit, we're at the DHS, the Wisconsin Department of Health Services website. And although the Omicron variant is right now dominating the headlines, the Delta variant is causing the spread locally and causing the increased case activity that we're seeing, and increases in hospitalizations and things like that are related to Delta variant spread. So with the Delta variant, again, the best way to protect yourself is to get vaccinated. It's important to continue wearing your masks and practicing social distancing, especially when we have, sorry, I got a phone call there. When we do have heightened case activity in our community, it's important to practice those protection measures and try to limit the spread of the virus. Just wanted to share a little bit additional data in terms of the data that we have available and where you may see information on the Omicron variant as it becomes more readily available if we do see cases start to pop up in Wisconsin. So I'm on the Wisconsin State Lab of Hygiene website, and this is linked actually from this Wisconsin Department of Health Services website. If you click this link, it will pull up this tab. But basically, when we look at the genetic sequencing of the COVID-19 cases that have been sequenced, we get a sense of the proportion of cases that are represented by like the Delta variant, and then the previous kind of variants of concern that we've seen. So I'm just pulling up the data here. These are month by month breakdowns of the type of variant that has been predominant in Wisconsin based on the sequencing that is occurring. And the red indicates that the Delta variant most recently is still highly predominant in Wisconsin. In the past, we've seen the spread of the Alpha variant and the Beta, and most recently we're seeing the Delta variant kind of taking control. So if you want to take a look and kind of monitor the situation from a data aspect, you can always go to this website, and as they identify additional strains, especially the Omicron variant, it will appear in this graph, and there will be additional information about the Omicron variant coming soon, hopefully, as we learn more about how it spreads and who's affected and who's most at risk. If the situation arises where we identify cases in Rock County of the Omicron variant, we will make that abundantly clear as well and try to provide as much up-to-date information as we learn more. So I wanted to check the chat box to see if there were any questions that had come through. There was one question that someone had asked between our live streams, and that was, what are the kind of the current ages of people who are dying from COVID-19 in Rock County, and what's kind of the demographic breakdown there. So I did want to share on the live stream today that predominantly over the course of the pandemic, those who have passed away from COVID-19 infection, the average age is about 74 years old. But most recently, we've seen a little bit of a decrease in the average ages. So in November, the average age of those who died due to COVID-19 infection was 58. In October, it was 70. And in September, it was just under 67 years old. So we're starting to see more individuals who are a little bit younger who are needing to be hospitalized for COVID-19, and more individuals in kind of a younger age bracket who are passing away from COVID-19. Part of this is because there is a very, very high vaccination rate among those who are 65 and older. And there's also high uptake of the booster dose among those who are 65 and older. So we are still seeing the effects of the vaccine, especially among the population that's 65 and older. Compared to earlier in the pandemic, there are a lower proportion of people who are passing away or needing to be hospitalized in that age group compared to those who are in a younger age group that have potentially a lower vaccination coverage. So it's important, again, that we make sure that if you are in need of a vaccine, you can go to rockcountyshot.com, and we have lots of information on rockcountyshot.com in terms of whether people are eligible, where you can go to get the vaccine, and those kinds of things. One other piece of information that I'll share is on our public health department website. So as you go to the coronavirus landing page on our public health website, we do have a couple of clinics that the health department is kind of facilitating in the community. So the first one is in partnership with the state of Wisconsin. In Janesville, we have a vaccine clinic at the former job center. So this is 1900 Center Avenue in Janesville. And the hours are here in the middle of the page, but basically Tuesday through Friday, we have vaccine appointments available from 11 a.m. to 7 p.m. And then on Saturdays, they are open from 11 a.m. to 3 p.m. You can sign up for appointments, and walk-ins are also welcome. And the vaccine is available for everyone who's 5 and older. So they do have the 5 to 11-year-old vaccine as well as booster doses. And there is no cost to anyone who shows up for the vaccine there. And the public health department is also providing vaccines and making vaccines available. So every Wednesday from 3 to 7 p.m., we are providing vaccine. And here's our address here, but we're at 3328 US Highway 51. And again, we have vaccine available for those who are 5 to 11, and also those who need a booster or who have not yet been vaccinated. So there are lots of opportunities to be vaccinated. If you do have questions about the vaccine in terms of the effectiveness or the risks to your health, make sure you talk to your healthcare provider and they can help answer those questions. You can also get additional information from the rockcountyshot.com website or our public health department website in terms of that information. So with that, I'm going to close out the stream for today. Thanks everyone for tuning in, and we will see you in 2 weeks.